Okay, hope everybody can hear me. I'll go ahead and get started now. So bear with me as I share my screen and go into the session. So my name is Scott Cadora. I'm the founder and CEO of Medicare Pathfinder. I'm also a Duke Wimba alum from 2000, and I guess I would be described as a serial entrepreneur. I founded my first company when I was 17, and have founded four since then. So today I'm going to talk about some key trends in healthcare and how you can apply them to a hackathon like this. And by the end of this, you'll understand some things. It's not going to be totally comprehensive, but you'll understand some things that are going on in healthcare, how you can apply innovation to them, and what's the between Steve Jobs, a platypus, and a pirate. So with that, let me just jump right into where we are in healthcare in 2020. And I'll start by referencing the obvious elephant in the room from my favorite scene from Zootopia. And if you are, at all self-aware, you know that this has dominated not only healthcare, but the for the past, 12 months, thereabouts, at least the past 10 months. So the biggest things that are going on right now, that it's testing to see who has it, getting PPP out to the health systems and to get everybody to wear masks, being able to manage hospital capacity, especially during surges when you have an outbreak. And then how do you deal with nursing homes where you have the most vulnerable population, and you need to be able to convey to them, make sure that they're safe, but also to make sure that they have the attention from loved ones and caregivers. And then, of course, vaccine development. There's obviously been a lot of progress in that in the past month. And then now we're moving into the vaccine approval and distribution process. So who's going to get the vaccines? How are we going to get it to them? How do we rank, priority for vaccine distribution when you're trying to vaccinate the entire world? Huge challenges, huge logistical problems. It's dominating everybody in the space. But let's talk about some of the after effects that are going to come. So one of the aspects is neglected care. And that means people who have not gone to the doctor or not gone to the hospital to get treatment for non-COVID issues. So whether that's oncology, whether it's heart disease, whether it's diabetes, variety of different care profiles that have gone neglected. And the data shows that that is having an effect on people's health. Some people are actually dying from non-COVID issues because they weren't getting treated for it. That's a huge issue that's going to have a lagging effect even after the vaccine is widely distributed. Long-term medical effects. The COVID has really impacted the entire medical ecosystem. There are many hospitals that have failed because they didn't actually have patients in that weren't COVID related. And the COVID they're not making any money on. It's the knee replacements, the orthopedics, those are the money makers for hospitals. They keep them open. When they didn't have them, those hospitals that were on the bubble, that were on the margin, they were not able to survive, and many have actually closed this year. That's going to have an impact on the care availability, especially for areas where the only hospital may have closed. And so now those people are stuck. They don't have a hospital to go to. Again, the corollary to that is hospital providers, healthcare providers have not been able to get their normal cash flow, their normal revenues, and that has seriously impacted their financial capabilities. Many are laying off staff. Many are having to cut back or close facilities, and that has an impact both for those providers and the communities they serve. And then you have a serious redistribution of talent that's likely to happen, where now all of a sudden a lot of doctors, a lot of healthcare providers are evaluating whether they want to stay in the space. Many are actually looking to go out. This has burned out a lot of people. At the same time, you've had a lot of people move into the healthcare facility or the healthcare industry where they've moved into either nursing or associative care. And so that's an opportunity and a challenge. And then the other aspect of this is ER visits have dramatically decreased. And it's shown a lot of people that they didn't need to go to the ER. In many cases, people were going to the ER for non-emergency visits. That increased costs. It's been an ongoing challenge for many years. Now that may have changed the model. And we'll talk about that in relation to telemedicine and other things. So telemedicine is the next issue. Telemedicine has finally come of age. When I was starting out one of my entrepreneurial journeys for Medicare Pathfinder, I was in a co-working space with a friend of mine who was a doctor, and he was starting a telemedicine facility, a telemedicine business. He got a lot of early traction. He got an A round of venture capital, got $12 million in investment, and in a year he had blown through it and the business closed because he couldn't get the providers and the consumers to start using telemedicine. It was a great app, but it's a network effect that he couldn't get the users and the providers to use it, and it shut down. Well, that network bubble, you've got mass provider adoption. Not everybody, but a significant number. You've gone through the technology adoption curve. So now you have the early majority and the lagging majority have adopted telemedicine because they've had to. So check mark for that. Consumers have adopted it because they've not wanted to go into the emergency room. They've not wanted to go see their doctor. They're scared. So the consumers have adopted it. The insurers, the payers, have finally been willing to promote this because it's a cheaper way for them to get people seen, and they can chalk up, especially in Medicare, they can Medicare Advantage, they can put into the government to cover the costs for that. So the payers have adopted it. The one area that has not quite worked itself out is the economic equilibrium. In other words, is the funding that pays for telemedicine appropriate to cover the cost and make sure that it's economically viable? And that is still an issue that is seriously under evaluation. The payers and the providers are wrestling with this very question, and it's still, out to the jury. One of the other aspects to consider is rural health. As I mentioned, a number of hospitals have closed. Many of those hospitals were in rural areas, and rural health was already wrestling with a significant decline in provider availability. If you've got a large geographic area with a small population, not many healthcare providers want to go there. And in the past, where one doctor may serve an entire town, those doctors are in many cases retiring or dying, and they've not been able to find replacements of new doctors and new healthcare providers to go into those towns. And so what do you do? So not only providers, but pharmacies. I was in a session earlier this year with the Lieutenant Governor of Georgia and most of the major health systems, and one of the big issues that they were wrestling with is there are areas of Georgia, and Georgia's a fairly modern state, but there are areas of Georgia where there's not a pharmacy within 100 miles, and that's amazing. People are driving 100, 150 miles to get to a pharmacy to get their drugs. That's a problem, and people are trying to figure out, how do you solve that? And in many cases, in many areas, there are no insurance plans or only one insurance plan. So people don't have an option in their insurance coverage. And in fact, when Obamacare was rolled out in 2010, 2011, there were some areas where insurance companies did not want to go, especially in many rural areas. And the state insurance commissioners were having to mandate that if you wanted to be in their state, you had to at least offer one plan. And in some cases, there were no plans available. So the state actually had to step up in some cases. So that creates opportunities. Can you use telemedicine to cover the gaps for rural healthcare? Can you use non-doctors to provide baseline medical expertise, physician's assistants, licensed practical nursing, RNs, registered nurses? Can you use them combined with telemedicine to be able to triage patients and provide a baseline level of care, and then reach out to experts, specialists via telemedicine or via Zoom to be able to provide specialty insights and to know when to prioritize somebody to get care at a larger facility. The other aspect of this that's very interesting, it's just starting to get talked about, is you're having an urban exodus of people leaving the big cities like New York, like San Francisco, like LA, and they're moving to rural areas in Colorado or Texas or Montana or Idaho. And these are generally younger people. And so they want a higher level of care and service. And so that may, in fact, provide some of the economic incentives for both healthcare providers and insurers to move back to rural areas. And then new delivery models. That really breaks into retail healthcare, which is another big thing that's happening in the past couple of years. Walmart has opened Walmart Health, and I know the roommate has been intimately involved in this operation. And CVS bought Minute Clinic. That was kind of the first segue into merging consumer health, being able to put a PA or a clinic into a CVS store. Walmart rolled theirs out last year, and in the first week, they had already booked up 3 months worth of appointments for their facility. And this was in the first Walmart store in Georgia. That caught a lot of people's attention. It showed that there was a significant lack of providers, and especially the affordability, the perceived affordability for consumers. And Walmart tapped into that and is using that model throughout the country. There's been a number of discussions between Dollar General, Family Dollar, and several of the states about using this type of model, because in fact they have a much larger geographic footprint, because a dollar store is much smaller than a Walmart. And so you'll find them even more spaced out in some of these rural areas. And so can they use that same clinic stores, which have a larger footprint? And then interesting is the return of house calls. Many doctors, many insurance companies, as a matter of fact, are using house calls to be able to reach out to people, because in many cases it is cheaper and the government will pay more for physicians to make house calls. And the insurance companies have realized this, and there's other economic incentives that cover the cost. But insurance companies are now actually hiring doctors to make house calls to both suburban and rural areas. And it's going back to the old way that it used to be. Yeah. So we may be going back to the past. One other area is new payment model. This is a sales sheet from Oscar Health, which is a very consumer-focused, data-focused insurance company. Clover is a similar one, that are using not only forward-thinking customer service along the lines of what you would get with Zappos, and using data science to reduce some of the economic problems traditional insurance companies have had, and translating that into better customer service and better economics. So these many of these came out of the healthcare exchange, the Obamacare, and some of the Medicare programs. Clover actually Oscar started in their Medicare, where the government is using companies to actually cover some of the difference from traditional for senior care. The other value-based care, where the government and insurers are working with providers to get outcome-based programs where it's not just saying, okay, I did an X-ray, give me $100. It's saying we're going to pay you for healthy patients, healthy outcomes. And so those are some of the different models that are impacting healthcare, and it's early stage, but they're still being worked out. And many of these are focusing in on helping consumers make better choices and using technology via smartphone apps, via websites, via smart scheduling. You can literally, with Oscar, you can get on and say, I really need to go see a doctor today. And they can look at the entire network and say, there's an appointment at this doctor. He's not the normal doctor you see, but you can go see him. They've got an appointment this time. We already looked at traffic and you can get there in 10 minutes, which is amazing to be able to have that foresight and apply that to the consumer experience of healthcare, which is something that traditional healthcare companies have never considered. Well, the new healthcare companies are, and that creates tremendous opportunities. So again, technology, consumer focused, using new economic plans, these are all some of the things that are going on in the insurance sector. And then healthcare analytics, and this is something that I know my company does. Being able to use data and integrate data into the side, but also the payment side and the consumer experience side. Being able to help seniors and help providers make better decisions by entering the data that's already in the system. And so this is one of the big pushes in healthcare right now is healthcare sits on a tremendous amount of data, but it's not used very well. Healthcare providers are not technology companies such as Amazon. Using artificial intelligence. Right now, most of the focus in healthcare has been on radiology, being able to look at different charts and different x-rays and to see if you can find a diagnosis that a radiologist or human might miss. But that's moving into other areas such as payments, such as diagnoses. And in fact, one of the COVID vaccines was actually developed using artificial intelligence and actually was able to discern a potential pathway within 48 hours, which is just tremendously amazing. And then connected devices, using your iPhone, using your Fitbit to manage your health care, to manage your health records. These are all things every major technology company is working on, and in some form or fashion. But there's some challenges with that. One is what's called an EHR platform. These are the electronic health records that many most hospitals use. The two biggest are Epic and Citric, and both of those are basically closed platforms. In other words, they don't want the hospitals or the consumers to be able to access that data. They consider that data to be the real gold in the equation. And so they've designed closed platforms that has from the consumers, from providers, and government. And I'm actually on a task force that's working on forcing those EHRs platforms to share data, and they are doing so, but reluctantly. And even if you can get it in many hospitals, the data is very siloed. It's very hard for hospitals data systems to talk to each other. You can have one data system for clinical, one for billing, one for records, one for pharmacy. And it's, in many cases, an issue of legacy systems where hospital systems are merged or bought another health system, and they never changed because it was too difficult to change their system. So now they may have 10 different systems that are all redundant, that don't talk to each other. And it's a big, big challenge in the healthcare world. And also, a lot of the data is really dirty. If you're in data science, this is actually your biggest challenge. This is 90% of your work, is being able to and work with the data because it's not in a very friendly format for using techniques. You've got to make sure that the data is uniform, accurate, and health data historically is not. It's very dirty. And then there's the culture, which is many healthcare providers, they are not used to dealing with data from a data science perspective. They use data from a clinical perspective to diagnose patients. They don't do it to be able to use. Being able to shift that culture is a challenge. So those are some of the big trends. Some of the, again, it's not comprehensive, but it's some of the big trends. So what's hackable in a weekend? You guys are just doing this for the weekend. Maybe you're going to build a business off of it, but you get limited resources, you have limited time. What can you actually do in a weekend? So let's talk about that for a second. Say what's not hackable. You're not going to be able to develop a COVID-19 vaccine. You have the resources, you don't have the technology, and somebody's already beat you to it. You're probably not going to be able to make too many durable medical equipment. You're not going to be able to make a new prosthetic in the time that you've got. It's too much of a regulatory process. You're probably not going to be able to create an insurance plan. It's and too regulatory intensive. And already a lot of telemedicine apps that are out there. They've really, gotten the early track. That's probably not an area you really want to focus on. And you may want to understand, again, this is an area where it just takes an awful lot of time and an awful lot of resources to make any headway. But what is hackable? Well, there are a couple things to consider. One is managing hospital surges. That's still an area people are wrestling with. Some are looking at doing different models of transfer patients from one hospital, able to take advantage of some of the gaps in usage. That's something you can play with. Playing around with the telemedicine, you may not be able to develop a new telemedicine app, but you can do something within the payment model space. Rural health is wide open. Play with that all you want. Retail health. Walmart and CVS have started, but there's no uniformity there. That's a complete white paper or whiteboard that you can play with. And Internet of Things, medical device, a lot of opportunities there. Fitbit is just a very rudimentary aspect to Internet of Things and using your wristwatch to manage your physical usage. There's a lot of other opportunities there, and really things with the medical talent scarcity. How do you make use of an area where there's not enough doctors, there's not enough nurses? How do you manage that? And especially incorporating some of the aspects of rural care, of burnout. Those are opportunities available. So I would urge you to innovate at the intersection. And this is the platypus reference I made. A lot of traditional companies, a lot of big established companies, they see innovation as a linear experience. And as a result, they do innovation very incrementally. And it's very traditional. It's very easy to see. It's obvious. The things that are real innovation are not obvious. It's combining the beaver playing a guitar and the duck playing the keyboard into a platypus playing whatever that musical instrument is. But that's something nobody had ever seen until you went to Australia, right? Nobody had ever imagined something like that. Well, it's the same thing with companies. And so being able to innovate at the opportunity of rural health and retail health, that's just now starting to come into effect. And nobody imagined doing that 2 years ago, but the first couple of experiences have been wildly successful. There's great opportunity there to do innovation. Improvement of logistics has never really been thought of in healthcare, but if you go up and down I-85 between Atlanta, Georgia, and Charlotte, North Carolina, what used to be farmland, hundreds of acres of farmland, are now all taken up by logistics warehouses and they've redone the entire road system to incorporate logistics that now know they can put a warehouse in one area and in between Atlanta and Charlotte, and they can cover 4 different states with that one warehouse. Well, if you incorporate that into rural health and pharma and drones, there's tremendous opportunity there to improve the logistics. Again, telehealth, retail health, and staffing is another area that you could combine different aspects and come up with something really innovative. So the whole point is just think in terms of putting 2 or 3 or 4 different areas together to come up with something new, completely new. Um, Again, 3D printing, physical therapy, and medical devices. If you're trying to create a new medical device, 3D printing offers something really amazing. But then how do you, that's just one piece of the equation. Being able to incorporate physical therapy and into that mix to improve the time off that people have to take when they get a new knee replacement, or when they get, if they were to lose a limb for some reason, being able to get that up to speed much more quickly makes their life much better and reduces the cost much more dramatically. So how do you create value? And you guys may have already seen this, the value proposition canvas. It's part of the business model canvas that Strategizer does. And if you want to, you can go to strategizer.com and you can download this for free. Initial aspect that you need to consider, which is how are you actually going to create value? And it first starts off with the area on the right. Start from the right and work to the left. So you need to focus in on the customer, and whether that customer is a consumer, a healthcare provider, an insurance company, the government, or somebody else. Start with them and look at the jobs that they're doing. Those jobs are going to be driven by either reducing a pain or improving a gain. And it's you need to consider what is their goal, what is their job, why are they doing what they're doing. You'll hear the term the 5 whys, and if you go to business school, why are they doing this? And it usually takes 5 whys to get to the real reason. And then what are the challenges that they face as they do that? And what are the rewards that they will reap if they achieve that goal? And one thing to remember is people will always avoid pain over securing a gain. And it's literally a 90% avoiding pain and 10% securing a gain. So focus in on their pains first. That's the big takeaway. Then once you understand what their problems are and what they're trying to achieve, then you can focus on your solution. What product or service are you going to do that's going to help them achieve their goal or do their job better? Are you reducing a pain? Are you increasing the rewards they get? And again, focus on the pain first and the gains second. That should be your focus. And I'll give you some insights from Steve Blank, who, if you don't know, he's a legend in Silicon Valley. He's a teacher at Columbia, he's a teacher at Stanford and at Berkeley. And if you've heard of Lean Startup, he's the guy that actually invented Lean Startup and worked with Eric Ries to develop that concept. And Steve is a great guy, and his mantra is, there's no facts in the building, so go get outside and go talk to your customer. Don't focus on your solution first. Focus on the customer and go out there and talk to them and understand what they are doing. And your assumptions are going to be wrong. So that's why you need to go out and speak to them and test your assumptions. And I would also use the guidance of, don't ask a yes or no, a question that can be answered by yes or no. Ask open-ended questions. What are you doing? Why are you doing it? What's the reward that you get from that? What are you trying to avoid? Those are the questions you need to ask when you're talking to people. And avoid the defensive trap of getting an idea in your mind and then trying to incorporate the feedback that you get to conform or confirm the issue that's already in your mind. Come in with an open mind, listen actively, ask questions that work off of actively listen to the customer. And the biggest question you should ask is, should we be doing this? Whatever it is you're going to do, should you actually do this? That's the most important question. There's another Steve in Silicon Valley. You might have heard him, Steve Jobs. And my old partner used to work directly for Steve Jobs. And one of the things he taught me was what Steve taught him. It's that what you don't do is far more important as a company than what you do. And understanding what we're not going to do is most of having a startup or having a new entity. You innovate, you're going to make mistakes, learn from them quickly and move on. Address them and learn from them. So don't be afraid to pivot. Don't be afraid to even shut it down if you have to, so that you can move on to something more crucial. So as you build whatever you're going to build, focus in on, is this something that we really should be doing? And if it's not, stop and pivot and move on. And it's more fun to be a pirate than to join the Navy. I had this on a sticker in my office, and I'll leave you with. I mentioned pirates. I'm going to leave you with one of my favorite aspects or scenes from Pirates of the Caribbean. So I hope you. Sorry, I'm just now seeing the things you couldn't see the video. Hopefully, I got conveyed the message to you. So, Sam, great question. COVID has impacted us adversely, like everybody else in the industry. On February 27th, I was actually presenting at HCA's, the largest healthcare company in America. I was presenting at their headquarters, and we had announced we had two major health systems that were working on pilots of our technology. And 2 weeks later, all of it got shut down, and they were all those pilots were shelved. We're working on getting one of them back online, but it's been difficult because those hospitals have all been just trying to manage the COVID explosion, and so it's impacted us. It's impacted most every other health company I know. Several friends of mine that were also healthcare entrepreneurs actually had to close their business. So it's, you know, when there's blood in the streets, there's opportunity, but there's also a lot of blood in the streets, and you might become part of it. One aspect that's somewhat interesting is that people are awesome or excuse me, people are reluctant to adopt new and long-term innovations in the midst of a crisis like COVID. So if you are going to focus in on the healthcare thing, you need to be able to give them a short-term benefit over a long-term benefit right now. Daniela, great question. Healthcare, as I mentioned, data in healthcare, um, it's going to evolve, and it's going to move through a couple of phases. Right now, everything data-wise in healthcare is driven by the EHRs. Um, and the EHRs have been very reluctant to release their grip on the data that they have, but both the government and the healthcare providers are going to force them to do it. It may come incrementally, or it may come in all one fell swoop. I don't quite know how the Biden administration will address this, but I know that there is a significant focus in Washington on getting data out both to the providers and, more importantly, to consumers. The ability to access your own data is a huge challenge for many consumers. You'd be tremendously surprised how difficult it is to get your own health records and to be able to share those to other doctors, because most healthcare providers see that as a liability, because in sharing your records, you might expose them to a HIPAA violation. And so their response is to lock everything down. We're actually working with several different healthcare companies right now who are asking the right questions of how can we use data to innovate. So a lot of people actually understand from a conceptual aspect that data can help them make better decisions and improve their care and improve their economics. It's the real transaction technology, because as I mentioned, much of their data is siloed, and that's because they either have it in an Epic type system, or they've bought different healthcare systems and none of them talk to each other. That makes everything take much longer when you're dealing with a healthcare provider. And things that if you were to go and ask Google, can you give me this data set? Just imagine a standard data set. Can you get me these records? Google will be able to give that to you in probably 30 seconds, maybe 5 minutes if it was really complex. If you ask the same question to a healthcare provider, that healthcare provider is probably going to take 30 to 90 days to provide the same data, because it's just not in their nature to be able to share data. And as a result of that, they're way behind the curve on data science. It's starting to change at the margins of the technology adoption curve. You look at those early innovators, some of those hospitals are starting to change. And it's actually starting at many of the academic focused hospitals like Duke, like Stanford, like Yale, where they're starting to be able to configure their data standards so that they can start doing this. And as they do so, as they make success in that, that will bleed over into the other ones. Are there any companies that currently do that job of connecting those healthcare agents to people in rural areas? Companies are reluctant to do so, and it's partly because there's been a consolidation in the healthcare industry. That most of the smaller health systems that traditionally focused in the rural areas have had to sell. They've had to merge with larger healthcare systems from urban areas. For instance, Sandersville, Georgia, they had a health system there, and they had to merge with one of the larger hospitals because they couldn't afford to keep their hospital open. So it's actually the reverse. Fahimi, it's the larger health systems are having to buy the smaller ones, and in many cases they're doing so at the behest of politicians and government to keep those health systems open. But when they do so, it comes at a price. They typically are shutting down portions of that, or reducing services, or reducing staff. and that's happening throughout the nation. Um, it's a big challenge that many independent companies have not been able to solve. Um, Favorite part about being a founder and CEO of a company, it's a great experience to be able to figure out how to solve a problem. Um, and in our case, we're solving a problem for 80 million people, 80 million seniors. Ultimately, we hope to solve a problem for about 350 million people. But that's really cool thing. It's really invigorating to work with a team of brilliant engineers and designers and data scientists. The challenge is being able to find a solution, but have a difficult time implementing it because many people are reluctant to adopt a new technology or a new system, even if they acknowledge, yeah, it probably would work, but that's not the way we do things. And that's been one of the biggest challenges to say, I've got a perfect solution for your problem. And they're like, yeah, you probably do, but it's not something we can do right now. That's a challenge. So, you know, it's a very creative world. It's a very cerebral, thought-inducing where you're saying, how can I solve this problem? You figure out a solution, and then, you know, it's difficult to sell just because the nature of healthcare. Largest obstacle you face through your entrepreneurial journey, how'd you overcome it? Two biggest obstacles that I would say. The first is when you are dealing with healthcare data and when you're dealing with insurance and government, it's very, very complex. And it's not something that you can do with a JV team. This is as challenging data science work as you can come. It's SpaceX is doing. And you have to have the people that have the engineers and the designers and the data scientists that understand how to operate with a challenge like this and to be able to solve it in a new way. And that takes creativity, it takes understanding, it takes a knowledge of technologies and health systems. And getting the people that can solve that has been a big obstacle. The other aspect to it is the capital aspect. Whereas venture capital from the outset seems like they're trying to solve problems and being able to fund companies that are solving big problems. In reality, most VCs actually want you to have already solved the problem before they invest, and that you've gotten lots of traction in the marketplace before they come in and invest. They only want to invest in the winners, and they want the winners to be obvious before they do. The problem with something in healthcare is that healthcare providers are so risk averse that they don't actually want to go in and do um, um, any new thing without being a sure thing as well. So it gets to be a chicken and egg problem, and being able to uh, get people to adopt it, to prove it out to the venture capitalists that they can invest, so you can actually roll it out to larger companies. That's a constant challenge. It's a constant challenge for any startup, but it's even more so. It's more focused in the healthcare space. Any other questions? To focus in on the last question as well from Hack Duke, how did I overcome it? The people thing, it's finding the first good person and knowing what their friends are. And generally, if you've got a really good group of people, more people want to join it. So it's getting the first person that really can help you, really understands it, and then help them to help you recruit more people. And the really smart people, the really good people, really all know each other, and they're all looking for interesting problems. So one of the ways of success is to have an interesting problem. You'll be able to attract a lot more people to your team. My email, I'll give you my personal email. Please don't abuse it. If you got any questions, please let me know. Happy to help out. And as you go through this, if you want to talk, I'm available to help you speak on the phone for a little bit and talk to you things. Is anybody doing anything focused on anything in healthcare? Is anybody want to work on something? Tell me about that. COVID side effects. That's interesting. I was actually on the MIT innovation team. We worked on a COVID project earlier in the year, and it was really fascinating to see some of the data. I was leading a team of 5 physicians and 5 data scientists from across the world, and one of the things that we saw was COVID vaccine side effects. That's even more interesting. The data that we saw, we had access to some data from Italy, from the US, and from China, and it was interesting to see the differences in the data from different countries. Europe and America data aligned very closely. Stuff from China, not so much. It caused us to question a lot of the things we were seeing in the news, and this was very early on in the crisis. This was March and April. So COVID vaccine side effects, man, that's super interesting. I wish you luck with that. Luis, I think that's a question for Sam. I'll let him answer that. So physical therapy at home, Laura, that's really interesting. Yeah, that's a very important thing because having gone through physical therapy for a bad car wreck I was in, it's really difficult to get people motivated to do their physical therapy. And you know, if you can do that and using if you've not looked into some of the behavioral economics that say the work that Dr. Dan Ariely is doing, that might be something really interesting to incorporate into that, because that would be a great way to incentivize people to actually do the physical therapy and then help their people to stay on track. Yeah. Um, Look into the behavioral economics. That might be really useful for your app, to get people to do it. You got to incentivize them properly. And if you don't know who Dan Ariely is, super interesting guy. Really likes everything that he's doing. We incorporate a lot of his thoughts into our work as well. Um, let's see. Hemi, that I'm super interested in what you're focusing on with the COVID vaccine rollout. Not sure where you would fit into the existing framework, because a lot of people are touching on that, but would be very worthwhile to pursue that if you could. You may have to partner with somebody on that. Partner with one of the advisors or somebody like that. Roger, working on finding ways to get information easier access to healthcare for underserved communities. So there's a number of different government incentives that are focused on that. CMS has got some things. Kaiser Family Foundation uh, has got kff.org. If you want to look them up, they've got some information on that. There's always an opportunity there. It's just a matter of what's been tried and how can you get people to do that. Advisors. Um, Off the top of my head, no, but I'll see if I can think through some. I honestly don't know enough um, about the vaccine progress, Femi. That I don't know who's working on that. I'll reach out to a friend of mine who's in the one of the COVID task forces and see if he can give any insights for that. So I'll see if I get that information. I'll post it back to Sam, and you can follow up on that. Yi Chen, working on an app that makes machine learning driven diagnosis for diseases such as melanoma more accessible to the general public. Not sure how LiDAR incorporates into it. That's an interesting thought. But yeah, I could see that this could have an opportunity for skincare. I think some of the companies are already working on that, so you may want to do some research to see what's already out there. Doctors generally are more reluctant to take machine learning if they don't know what's driving it, if they don't know the decision making. So make sure you're very focused on, you can document how you arrived at that diagnosis, because if you can't prove that out, consistently show how you arrived at that, you're going to have a real hard problem to get adoption. The providers, just from a sheer personal, professional aspect, but also from a legal aspect, are going to be wanting to know how you arrived at that diagnosis. So make sure you build that into your technology. A few more minutes left if anybody has any more questions. If not, what do you think about building a method of COVID contact tracing? So a number of people that worked on a project for this as part of the MIT program. It's been challenging because so many people don't know where they actually got sick. There have been, obviously, Apple and Google have worked on some of the contact tracing with the phones, being able to use your phone. They've struggled with adoption. People have been reluctant to put those apps on their phones. That may change. I'm not sure. Again, behavioral economics plays an important part of this, to get people to share that data. But also, it's a matter of, can you build it in early enough? I saw one thing earlier today. There was one of the news stories that somebody's developed a new app to diagnose it much more quickly than using a test that may take a couple of days to get an appointment, and then a couple more days to get diagnosis, and then do you have a positive or false positive, and can you go get a second diagnosis to make sure that you have it? By now you've got 10 days into it, and so how do you do that? Look at what's already been done, but look also is how you can use behavioral economics to make sure people adopt it. So Sam, we still have any more time for any more questions, or we need to wrap up? Okay. Well, if anybody has any questions, please let me know. Enjoyed talking to everybody, and wish everybody good luck, and let me know if I can assist further. Y'all have a great day.